Welcome back to Daytime. We're here with Dr. Robert Jones talking about hair transplanting. And what are some of the latest advancements in hair transplanting?
Well, the latest advancement in the past 3 or 4 years is where we take hairs one at a time from the back, and we transplant them one at a time on your head, the top of your head.
One at a time.
And so, basically, one hair or one follicular unit in a go. So a follicular unit is like a family of 1, 2, or 3 hairs. And as you can see from my hairline, is basically they're all transplanted one at a time. And so
that's your real hair.
That's my real hair. I have to get a haircut. It grows, and this is mine. So you transplant them one at a time. So there's no irregularities to the scalp.
Right.
The old methods where they used to transplant 10 to 15 hairs, that's the traditional sort of doll's hair, the plug appearance. Just obviously just doesn't happen anymore. It now looks as natural as if it's your own hair, and it's the hair that you had years ago.
And how long does the procedure take?
The patient, depending on the number of grafts they get, are in the office for somewhere between sort of 4 and 6 or 7 hours. So it can be for a large session. You can be there for an entire day to get.
Can you take a nap in the chair?
Well, people fall asleep. They start snoring or watch movies. They're wide awake or they can't stay wide awake. Just
keep still.
I know. Keep your head straight.
Well, they're in an operating room chair or a comfortable operating room chair, and they have like a pillow behind their head, so they're very comfortable watching a movie and very little or no pain involved in the procedure.
And you perform all the procedures?
Yeah, I'm the only doctor at the clinic, so I do them all myself.
And no appointments this morning if you're looking for Dr. Robert Jones, everybody. Where can we find you?
I'm in Oakville. Probably the easiest way is through my website, which is torontohairdoctor.com. It would be the easiest or just do a search on the web for Dr. Rob Jones and hair transplants, and I'm there.
Can you explain what the Jones technique is?
Well, the Jones technique is a technique I developed about 4 years ago, and I've taught it to physicians around the world. And basically what it is removing grafts with a tiny punch and removing them one at a time from the back of the head and transplanting them the same way. And the advantage of that is you have no scar on the back of your head. So you're just basically taking them out one at a time and putting them in the same way. So it avoids the need of a scalpel or scarring or anything else.
There was a feature also I saw on you and your clinic. Most people, when they think hair loss, we think male and on our heads. But you have a lot of clients who are female who are replacing their eyelashes.
Yeah, eyelash and eyebrow transplants have, because of the press, eyelash and eyebrow transplants have become incredibly popular in the past 3 or 4 months. And, women, especially Asian women with very fine eyelashes, fine and thin eyelashes, want a thicker eyelash. And it's not a very difficult procedure to do. We basically just take hair from the back of the head and we put it into a tiny slot on the upper lid. And I can usually transplant 60 or 70 hairs into an upper lid and cause quite a full upper eyelash within probably an hour and a half or 2 hours.
Wow, that is amazing. And speaking of Asians, I am also Asian, and we don't have a lot of hair on our chest. But I'm sure it wouldn't be advisable for someone to get transplants into their chest, would it?
Well, into their chest, I've never done. I mean, I've taken,
I was just kidding.
I
was just kidding.
I hope you are. So, with the eyelash transplant, does that hurt, or how does the hair grow when it goes into that?
Well, I mean, the only problem with an eyelash transplant is we are taking hair from the back of the head, and the hair will continue to grow, even though, and so the characteristic of the hair in the donor site is the same as in the recipient site. So the only downside of that procedure is the patient has to trim their hair, usually every 5 to 7 days. They just have to trim it slightly.
That is really interesting stuff. Thank you very much for joining us. We'll watch out for your book, The Complete Hair Replacement Guide by Dr. Robert Jones. We'll be back on Daytime. Please stay with us. Thanks for coming with us.